Hey guys, how are you all? Welcome back to my first aid series. This is episode 7 and today we are covering overuse injuries of the elbow. You can see here headline. So today we are covering overuse injuries of the elbow. So mostly we are going to focus on tennis elbow and golfer's elbow. First of all, tennis elbow. In tennis elbow, we can also known as lateral epicondylitis. Okay, so why this pathological conditions will happen? Because of repetitive extension or backhand or idiopathic means unknown cause pain near lateral epicondyle. So what are the main causes it's happening? What are the main cause? So this happens due to repetitive extension of the wrist, while when doing backhand shots in tennis. It can also happen idiopathically, like without a clear cause. Okay, so repetitive extension. Next, in pain location, mostly the pain is felt on the outside of the elbow or pain near to lateral epicondyle. Okay, so mechanism. Why this thing happens? So in mechanism, mostly we can see the lateral epicondyle is where the extensor carpi radialis brevis. If you are seeing this image, you can see here this pain mostly we can see in lateral epicondyle. Okay, in lateral epicondyle region, in lateral epicondyle where the extensor carpi radialis, the muscle is passing here, the lateral extensor in lateral epicondyle where the extensor carpi radialis brevis ECRB in simple form and some other extensor muscles attached. The muscles are involved in wrist for extension. Overuse cause tiny micro tears in the ECRB means extensor carpi radialis brevis tendon leading to pain and a process called angiofibroblastic tendinosis. This means excess fibroblasts and abnormal new blood vessels at the tendon. In important, this is not a true inflammatory process. Okay, it's more about degeneration than inflammation. In examples like casual tennis players using lots of backhand strokes are at risk because the force travels through the lateral epicondyle. Okay, so this is not generally little to no true inflammatory infiltrate. Okay, so we already discussed this everything. So now next one, medial epicondylitis. Medial epicondylitis also known as golfer's elbow. Okay, so what are the causes? It's like repetitive flexion or forehand shots or idiopathic pain near medial epicondyle. This happens due to repetitive flexion of the wrist, like when doing forehand shots or swinging a golf club. It can also be like idiopathic. Mostly the pain location will be like pain is felt on the inside of the elbow and near the medial epicondyle. So the mechanism will be the injury affects the flexor muscles of the forearm. If you are seeing this image, you can see the flexors muscles, muscles of the forearm which attach at the medial epicondyle leading to similar micro tears and degeneration. Okay, so here in this medial epicondyle in tennis elbow we can see lateral and outside of the elbow and mostly extension. In golfers we can see medial and inside of elbow and flexion. These both are overuse injuries affecting the tendon near their attachment points on the epicondyles of the humerus, but on opposite sides. Okay, so I showed already image and everything. So for this thing, what treatment we can do? In treatment, mostly we have to focus on rest and we have to avoid activities that cause the pain, and we have to apply some ice application like 15 to 20 minutes. Okay, and 3 to 4 times per day to reduce pain, and we can use some NSAIDs, ibuprofen like 400 to 600 milligram POBID for 7 days and for pain relief for short term use. And we can start some physiotherapy like stretching and strengthening exercise for forearm muscles, and we can start with some eccentric exercise like slowly lowering the wrist and help tendon healing. And we can apply some bracings or straps, counter force brace worn around the forearm to reduce the strain of arm tendons. And we can, it's in severe condition, we can start corticosteroids like only for severe cases, like not for first line. Then also if it's not getting cured, then in rarely we can start with surgery only if symptoms persist greater than 6 to 12 months despite treatment. In prevention, warm up properly before sports, and we can use correct technique and equipment. Example like rack waist size grip, like strengthens forearm muscles to reduce tendon stress, and we have to avoid repetitive strain by alternating activities or resting. Okay, so that's it for episode 7. If you found this video, this first aid series is helpful, don't forget to like, share and subscribe for more first aid tips. Okay, so see you in our next episode. Take care. Bye bye.